Hi. Most of you probably seen me before, and I'm just going to show this. I didn't expect that we had actually, I needed to use both hands. But just to show you this is what I'm going to talk about, this kind of white thingy here. So my name is Karin Breider, and I'm the CEO and co-founder of Colsix. Colsix works with a peptide technology that we're using in wound care, and especially then for chronic wounds. Chronic wounds are usually infected, and they are high maintenance for the health system. Patients that has a chronic wound would be needed to go to the clinic every week, twice a week, 3 times a week, to meet a nurse to have their wounds cared for. Our aim is that this should shorten. You should not have to do that year after year after year. And also, the burden for the patient, the agony they have, we would like to lower that. So with that said, over 10 million patients, and then, of course, a huge market. In addition, if one puts this on very heavy inflicted wounds on horse legs, the veterinarians and the house owner are really happy. So what we have? Well, we have something that we have a preclinical proof on animal testing, that we are 4 times faster healing than our comparator on infected wounds. And why is infection important? Well, for chronic wounds, that is really important because they get infected. How do we do this? We have a native collagen 1 dressing. That is evolution. In your body, collagen 1 is in your skin, intertwined with collagen 6. We've taken 2 collagen 6 peptides, cross-linked them into a native collagen 1 dressing, and therefore we get everything in one go. This dressing is then active for the cells, wound healing. They're active on antibacterial. They protect from bacterial infection. And also, we've shown very clearly that they're non-cytotoxic. They're non-toxic peptides, and the collagen 1 dressing is, of course, completely natural. So, we are here, of course, to raise money. And what we need that for is that we would like to be able to finish our clinical investigation. What we have today is a final product. It can be marketed for the veterinarian market, but we need more proof to get into the human market. And for the first round, we would like to then finish our investigation. We will, of course, partner and launch in the vet market. And as we already have some discussions, we would like to do those to have our peptide technology out-licensed for other diseases, other technologies. In the end, we would maybe need some more money to get access to the US and European market, and as well to partner with the sales organizations. So with the clinical investigation, we do have an ethical approval. We've gone through a lengthened validation at the regulatory deal, and we're now under scrutiny from BfArM in Germany to be able to start the study. Thank you.
Thank you so much, Karin. Great presentation. Just time for just a very quick question. You mentioned going for the EU and US markets. Are you aiming for other markets as well?
I mean, the initial ones are there too, of course, because that's kind of where it's the easiest way for us. We're going for EU first, and that depends on that we have a very nice EIC grant in back. So therefore, that's the first one. But still, the US market, of course, it's the largest market for these kind of products.
Absolutely. Well, unfortunately, that's all the time we have right now, but I'm sure others will ask.
So I'll see you. We're having coffee now, right? So, you know.
That is correct. You stole my line.